Health Minister Dr. Phaahla, his deputy Sibongiseni Dhlomo and KwaZulu-Natal Health MEC Nomagugu Simelane will conduct site visits at facilities affected by the recent floods today. Last night, President Cyril Ramaphosa announced that mobile clinics will be erected in areas where infrastructure has been destroyed to ensure that patients are still able to access their chronic medication. Newzroom Afrika's Ziyanda Ngcobo is at the Prince Mshiyeni Memorial Hospital in Umlazi, which is the starting point for today's site visits. Ziyanda, very good morning to you. The assessment on the extent of damage is something that various ministers and various departments will be doing today. And as you go through what the extent of damage has been, what are you observing ahead of this visit?
Well, I think it makes it much easier, Mpho, that now it's been declared a national state of disaster, which then means that it's all hands on deck from both a provincial and a national level. So when it comes to these assessments, and what it also means is that all these ministers and MECs will be feeding back information as to just how much money will be needed in terms of infrastructure, for an example, but also the three steps that need to be taken. You'll recall that the President announced 3 phases that will be taken to respond to this disaster. That includes reconstruction, it includes stability, and it also includes looking ahead into the future. As we stand here at the Prince Mshiyeni Hospital, one of the issues they face is with water, and you'll know that that is a critical resource to be able to provide the necessary assistance for those at the hospital. And of course, the roads and infrastructure just driving into Umlazi still remains an issue, and this is also one of the areas that was affected by the criminal elements that have taken advantage of this crisis. So as we stand here, we know that the health minister is expected to be here, but the MEC is standing here. She's right behind me with the deputy minister of health, and of course this will form part of the coordinated approach that needs to be taken to respond to the issues within the province, knowing very well that the health system, not just in KwaZulu-Natal but across the country, is under severe pressure, especially public hospitals such as this one. It's one of the biggest, and it caters to so many communities, not just in Umlazi, but also the greater southern parts of Durban. So even before, the flooding and the issues that were faced, Prince Mshiyeni had, many issues that I think, were needed to be dealt with. And you'll know that someone like Dr. Sibongiseni Dhlomo is quite passionate about the national health insurance. But Mpho, this is just one of the hospitals we'll be visiting. There'll be other areas that we visit as well this morning.
And in terms of some form of a breakdown on the number of hospitals that have been severely damaged, has there been an indication at what the department is looking at in terms of repair?
We haven't gotten that number yet, but there are several hospitals that have been damaged, and I think that's something that we're likely to get as we continue with our walkabout. That's information that will be fed to the health minister by the KZN health MEC. But what we do know is that this health department has been primarily tasked with dealing then with those fatalities, because they'd be the first to know. So they are critical departments in terms of managing, the bodies and those who are in need, and then being able to ensure that there are post-mortems, which has been the issue here. If the funeral parlors and undertakers are anything to go by, they've said that the severe problem here has been with the ability to get those post-mortems done so that families can finally get closure and bury their loved ones.
Very well. Let's leave it there for now. Ziyanda Ngcobo, senior politics reporter, giving us a sense of what's happening on the ground ahead of the ministers of health as well as the MEC station there, trying to assess the extent of damage.